for inviting us all here to help complete your historic task. Small Business Majority is a nonprofit, nonpartisan organization founded and run by small business owners and focused on solving the biggest problem facing small businesses today, the skyrocketing cost of health care. We speak for the nearly 28 million Americans who are either self-employed or own businesses of up to 100 employees. Our organization sponsors scientific research that guides us to understand and represent the interests of small businesses across the country. As President Obama stated unequivocally last week, the healthcare status quo is absolutely unacceptable. Indeed, our research shows that enacting comprehensive healthcare reform is small business owners' #1 need. Over the past several months, we have randomly polled small business owners in 17 states in every region of the country. 72% say they are struggling to afford health insurance, and of the majority who don't offer coverage, 86% say it's because they can't afford to do so. This is no surprise, given that on average we pay 18% more than big businesses for coverage. Recent economic research conducted for us by noted MIT economist Jonathan Gruber shows that under the status quo, small businesses will spend $2.4 trillion on health care premiums over the next 10 years. Significant reform based on the framework set forth in H.R. 3200 would cut that cost increase by more than a third, with commensurate improvements in wages, profits, and job creation. Just last week, the Commonwealth Fund issued a report stating that small businesses stand to benefit the most from health care reform. The report noted that the 39 million Americans work for companies with fewer than 50 employees, but just 25% of them have health insurance through their employer. Indeed, small business employees are a significant portion of the uninsured population. Of the 45 million Americans without health insurance in 2007, nearly 23 million were small business owners, employees, or their dependents. Behind the statistics, there are millions of individuals struggling with medical bills while trying to keep their businesses afloat. We hear stories every day from small business owners who can't get coverage because they've been sick or because the health plans they're offered are outrageously priced. Louise Hardaway, a would-be entrepreneur in the pharmaceutical products industry in Nashville, Tennessee, had to give up on starting her own business just after a few months because she couldn't get decent coverage. One company quoted her a $13,000 monthly premium for herself and one employee. Despite the confusing and distracting noise over the past month or two, we must remember that, like the rest of America, there is widespread bipartisan agreement among small business owners on the key elements of reform: setting up an exchange to purchase coverage, cutting costs, reforming insurance rules, and covering everyone in a way that's affordable. As evidence of this consensus, our polling of small business owners this summer found that 83% support the elimination of the insurance company's pre-existing conditions rules. 81% support the establishment of an exchange where individuals and small business owners can purchase insurance. 67% support the concept of shared responsibility among all stakeholders to finance the cost of health care. And a majority cites the cost containment as its #1 concern. This broad consensus is underscored by the fact that our sample, as always, was overwhelmingly Republican and independent. We compliment the House committees for working hard to improve H.R. 3200, and we particularly appreciate the efforts of the committees and the House leadership to seek small business input into this legislation. We are pleased that the process to date has produced a plan for a robust national insurance exchange, wholesale insurance reform, a plan to cover everybody accompanied by necessary affordability guarantees, critical provisions on cost containment, including reasonable tort reform measures, and a sincere effort to accommodate the needs of the smallest businesses through exemptions and tax credits. We also acknowledge the willingness by House leadership to listen to our strong recommendation that we enact the pending bipartisan legislation that would correct the tax inequities now faced by the nearly 22 million self-employed entrepreneurs. We hope the House will give serious consideration to making this change. Now we must all focus our energies to complete the legislative process. All stakeholders must stay constructively engaged with the Congress and the President as this historic legislation moves forward. There are good ideas in all the plans, the Houses, the Senates, and the recommendations President Obama made last week. With continued dialogue and discussion, we will get the best results for all. As our recent economic study shows, failure to act will devastate small businesses in many ways. Jobs will be lost, wages suppressed, profits reduced, and business investments shrunk. It's been said many times, but it bears repeating. We cannot let the perfect be the enemy of the good as we address this unacceptable state of affairs. With hard work over the next 2 months, we will pass a bill that will reverse our destructive course and ensure that affordable, high-quality health care is available to every small business owner, every small business employee, and indeed every American. Thank you.
Thank you. Dr. Hacker?